Hi, my name's Alifia Chakera. I've been asked to speak to you about my experience of the Masters in Public Health program at Edinburgh University. Just to give you a little bit of background about myself, I'm a pharmacist. I trained in Australia. I came over to Britain in 1995 to really just have an adventure and explore the NHS. By the late 90s, I was working in the NGO sector, had a really deep interest in health inequalities and general human rights issues. And I started working in not-for-profit organizations, looking at examining the impact of macroeconomic structures on health infrastructure, but also things like trade-related international property rights and their impact on access to medicines for low-income countries. So I think it's a little bit of me. As I started to have a family and my family size grew, I returned to community pharmacy just for the flexibility. I had the opportunity of working in Barbados, which was wonderful. That when the kids were young, and I ran a small business. When we returned to Britain, a chance came that we could move to Edinburgh, and we're very, very keen. We really love Scotland, and it was a really good move for us as a family. So we leapt at it. The kids were young. They just started. The youngest started school, and I, like many women, I was sort of reassessing my life goals and what I really wanted for myself. I took the decision to return to clinical practice through a chance meeting in the park. So in 2017, I began hospital pharmacy again, which was really, really good for me. And in the same year, I began the Masters in Public Health program with the University of Edinburgh. Now, the decision to undertake that program and to take the three-year course as opposed to two-year course came after much discussion with the tutors within the university and speaking to colleagues. And that was, I think, undertaking the three-year course was a really excellent option for me with a young family, with work. But also, I think the three-year course, because it does run over 3 years, you make friends over that time that a 1 or 2 year program may not allow you to develop those sort of extended networks. So that was great. And I have friends and colleagues for life as a result in a very global community through the program. Now, for me, the master's program allowed me to look at the global issues facing our time. And I was really keen to sort of go back and have a wee look at that, or a serious look at that, but also develop a really rigorous approach to learning and problem solving, which the course also will give you. For me, very early in the master's program, I realized climate change was probably the biggest threat facing us, the biggest global health public threat. I was naive to climate change prior to this course. I think I thought all the personal changes I was making, the COPs since 1995, were having the desired effect, and that we were on our trajectory, a desirable trajectory. I was hopelessly wrong. And I realized rhetoric and practice were not aligning. And I realized I also really wanted to make climate change the focus of my professional work, because for me, health inequality is the thing that really, that climate change, again, it polarizes the difference between the rich and the poor, just gets even more exacerbated through climate change. So I took my first permanent role in a long, long time. When I began the MPH, I started with NHS Lothian as their lead theatres for lead pharmacist for theatres and anaesthetics. I obviously immediately brought sustainability to the role. I was keen to look at obviously their drugs. Anaesthetic gases are potent greenhouse gases, so immediately focused my attention on that. I noticed very quickly the anaesthetists were keen to make professional changes that were sustainable, and this was evidenced in their switching of volatiles to the more environmentally friendly volatile, which was really evident. But I couldn't understand why the nitrous oxide footprint, which is also an anaesthetic gas, was unmoving. So I set my attention to that, and my dissertation focused on this mitigating this agent. And this is where I think the rigor of the MPH came to play, because through undertaking a dissertation and through the discipline exerted by the tutors, I quickly realized that we were wasting nitrous oxide. And I don't think we would have come to these conclusions without that sort of strong academic rigor. Anyway, I'm going to cut a long story short. This has really altered how we supply and manage this gas. We are, and my work has gone global. I've now been recruited as the head of nitrous oxide mitigation for the Scottish Government. And that has a really strong global remit. So the plan is to really flatten these emissions in the next 5 years within Scotland, but also to spread and scale this work globally. Now, I'm going to conclude there, but just to say that the climate threat is very real. It's an ecological threat of our own making. And I think if you are planning to become a public health practitioner, sustainability and climate change mitigation adaptation measures must be embedded into your work. And I cannot recommend the MPH program enough. So with that, I'm going to leave you. Slowly, I think I've overrun, but I really enjoyed having the chance to present to you. All right, bye.